So our next case today is embolization of a middle meningeal artery branch. So we perform middle meningeal artery embolizations in patients who have a subdural hematoma and have had chronic subdural bleeds. And they've been to the OR at least once or twice for evacuation of this hematomas. However, they continue to have recurrence of the hematoma. So with middle meningeal artery embolization, we're going to the vessels outside of the brain that fit the scalp and fit the meninges, and basically stopping the blood flow to those meninges and decreasing the chances that the hematoma would return. Go on, roadmap. Still our third case for the day. So this is the middle meningeal artery embolization. We now have access into something called the external carotid artery, which is the vessel that feeds the outside of the brain. Basically, what we're trying to target is to find a way into this very tiny vessel that goes up here, which is the middle meningeal artery. We have now used something called a microcatheter to get distal access into the middle meningeal artery, and you can see from an injection here, we see the frontoparietal branch and the temporal branch of the middle meningeal artery. So we're getting ready for our treatment with embolization with particles. Once we've started our embolization and basically decreased the flow to the distal branches of this vessel, now we have preferential flow to a vessel called the meningeal/orbital branch here, which fits the eye. So it's very important that we can recognize this vessel, because we do not want to treat this vessel as it can cause blindness. We were able to successfully treat the frontoparietal branch and the temporal branch of the middle meningeal artery, and keeping that meningeal/orbital branch patent. Again, we do not want to treat that vessel to reduce the risk that this patient could have blindness. And the goal essentially is to prune these vessels up here without hurting this vessel, which was done successfully.